Hello everybody, I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and today we're going to be talking about a very important topic in most women's life, breastfeeding. Only 40% babies in India are exclusively breastfed, a number much smaller than what it ideally needs to be. There are many myths, misconceptions, misinformation that we need to clear on this topic. And breastfeeding is a proven thing that it's fantastic for both mothers as well as babies. It improves the IQ as well as immunity of babies. So let's talk about breastfeeding. We have two lovely doctors, Dr. Charulata and Dr. Mangala. And we have two lovely ladies, both of them are Sayali, to talk about their journeys. Yeah. Dr. Charulata, what are the health benefits? You know, we always talk about the health benefits, but can you be more specific about health benefits for both mother as well as the baby?
The advantages are so numerous. They start right from, as you rightly said, increasing the immunity of the baby. That's probably the first vaccine that the baby receives in the form of a number of antibodies which can prevent so many infections in the baby, whether they are the GI infections, that means the stomach infections, whether they are respiratory infections. That is one of the most important advantages. The second advantage is that it has been seen that obesity is very less in children who are exclusively breastfed. And it has been proven beyond doubt that the IQ of children who are breastfed is way higher than the IQ of the other children.
Right.
You know, the diseases like diabetes and blood pressure, all these are going to stay away from, the children who are going to be breastfed. What is more important is that mother's milk is going to change with the needs of the baby. So the newborn baby receives milk which is just right for that, and as the baby keeps growing, the milk is going to change according to the needs of the baby.
Right.
And so what more can you want? This is one of the best things that you have something so clean in such wonderful containers at room temperature and just available on demand. The advantages to the mother are so immense. First and foremost is the entire weight that she has gained during pregnancy, which is a necessity. The mother can shed off that weight much more easily when she starts breastfeeding. Secondly, the uterus, which is enlarged during pregnancy, is going to come back to its normal size and shape the minute she starts having exclusive breastfeeding. Right. So all the organs go back into their place once the mother begins something which is so natural as breastfeeding. Okay. Thirdly is that, postpartum depression is going to be so much less. And fourth, and so very important and close to my heart, is that the incidence of breast cancer is going to be much less in women who have breastfed their babies. So when there are so many advantages, again the question arises that why such low rates of breastfeeding?
Dr. Mangala, lactation, which is the same as breastfeeding, what does it involve? What are the various stages? Start from the beginning.
Yes. Lactogenesis means preparation of the milk in the breast. So that actually happens during pregnancy. As soon as the mom conceives, there is a beautiful play of the hormones. And at mid-pregnancy, you can see some secretions coming from the breast. So that is a lactogenesis 1. And the lactogenesis 2 starts after the delivery. Right. So 30 to 72 hours, the mother produces copious amount of milk. And then there is a maintenance of the lactation. So you understand that this lactogenesis happens every woman, it is a physiological. So when every mother produces the milk, why the rates are so low? Only 41% of the babies are exclusively breastfed. And that is simply because breastfeeding is natural, but it is a skill that any skill that we have to learn. And plus we have to have some guru, some guide who can guide us. So similarly, the mother has to have from pregnancy the antenatal classes, then after delivery, initiation within 1 hour. So if all that, and if she has the knowledge, definitely the breastfeeding success goes higher in her.
The stark reality is that there are complexities, and many complexities because of which the statistic may be 40%. Not all of it is because the mother doesn't want to feed the baby. So can we talk about the complexities?
First and foremost is breast engorgement. And she lands up with these swollen breasts which are tense, shiny, tender, and she is in tears because she just doesn't know why this happened and how it happened. It usually happens essentially because everybody tells her, or rather many people tell her, that there is no milk for the first 2 or 3 days. What you're supposed to do is start feeding from the 3rd day when the actual milk starts, which is such a myth, which is such a wrong thing to tell. Essentially, because immediately after the baby is born, the baby needs to be latched. You know, we put the baby onto the mother's abdomen. We help the baby to latch onto the nipple and areola, and the baby has to start suckling right at that instant. And so because for 2 or 3 days she hasn't fed, the entire milk accumulates and it becomes this kind of a breast engorgement. Now, second most important thing is cracked and sore nipples. Okay. Now, they start the breastfeeding and suddenly they realize, oh my God, this baby has got such hard gums. This baby is biting onto my nipple. And the nipple gets cracks, or the nipple starts bleeding, or there is pus out there. It happens when the latch is not particularly correct. So we have to realize that the nipple and the surrounding black area, which is called as the areola, they have to be completely in the baby's mouth, not only the nipple.
Right.
Only when that occurs, is the chance of a sore nipple or a cracked nipple going to be much less.
Got it.
Secondly, women are sometimes obsessed with cleanliness, and they tend to keep on cleaning the nipples and areola, which is not necessary. Okay, this dries up the nipple and causes more cracks.
Right.
Instead, you're just supposed to moisturize it. The mother's milk is one of the best moisturizers that we can have. And of course, if the things are really bad, the doctors are going to prescribe some cream, some emollient, which is going to soothe the nipples and the areola. And yes, we can definitely overcome this particular problem.
But when it comes time to weaning off, again, some people, I know 6 months is what the standard is. But what are your thoughts around weaning off the baby, starting solid foods, formula, all of that?
The World Health Organization has given the recommendations. The first is initiation within 1 hour, we mentioned earlier. Exclusive breastfeeding, that means nothing. No honey, water, gripe water, gutti, whatever is given to the baby, the glucose water, cow's milk, formula, nothing. Only mother's milk for first 6 months. After 6 months, along with the breastfeeding, the baby will be started on complementary feeding or the Purak Ahar. And how that Purak Ahar should be homemade, hygienically made, freshly made, enough quantities and not watery like dal ka pani and all, nothing like that. So with that complementary feeding, breastfeeding should continue at least till the baby is 2 years old. If you see the benefit, the longer the breastfeeding is given, the more benefits. And you can see that child definitely is different.
One of the things we don't speak about is, for whatever reason, whether it is a medical reason or a personal choice, if a woman decides not to breastfeed, she is put through so much guilt. Like, you have not done justice to your baby, and your baby is not going to have A, B, C, D because you chose not to breastfeed.
That is why we have to discuss, about this less milk. Why a mother has the less milk.
Right. What are the reasons for that, doctor?
See, first thing is, after the birth, the colostrum or the cheek doodh is in small in amount. But even the baby's stomach is small, like children play marbles. So it is just 5 to 7 ml. Correct. So that small amount is enough for baby. So frequent feeding, bar, whenever the baby is hungry, if that is given, it is enough for baby. So, but it is taken as she has less milk supply. Sometimes they pinch the nipple, aur aapko doodh hi nahi hai. Poor thing, mother has no experience, and somebody says like that, her confidence goes down.
Correct.
So it is very important that we always keep the mother's confidence up. Surely somebody who has delivered the baby and her milk supply has gone down, there are ways. And milk definitely can increase, at least to some proportion the milk supply can increase.
Right.
And she can continue the breastfeeding.
The first thing that you're supposed to do is just give good colostrum, which is going to be coming out of the mother's breast. That is the first and only thing that the baby should be receiving. No guttis, no water, no gold, no honey, no angara, dhupara, nothing. So I think, we really need to get this very clear, because this can cause infections.
Please talk about what they feed the mother as well. All sorts of, let's talk about that as well. I was traumatized.
They give, only the boiled or the kuskurun, what we call in Marathi, very tasteless food.
They give a lot of laddus with lots of ghee loaded with the shira.
That is also not needed.
So what we need is mainly proteins, vitamins and minerals.
And mother should be happy, then only she will have lot of this hormone called oxytocin,
of course,
which is
there's always a mind-body connection,
and that is the love
very
hormone.
Important.
So automatically her milk also flows then.
No, that is so true. And with that, let's move on to our two beautiful women here. So, Sayali 1 and Sayali 2. Miss Sayali 1, let's talk about your journey.
My journey was, you can say, mix with the all happiness and sadness actually. So, Charu ma'am is my gynac. So, she was there since day one when we started or planning for the pregnancy. So, when I got to my 3rd month, I got to know, but again one surprise, that I am having twin babies. So, they were like identical twin, and unfortunately in 7th month, which is in my 29th week, so we went to my growth scan, and suddenly we got to know one baby is no more. So it was like horrible situation for us. We never thought of it. So she said, okay, let's take the another baby out and see what happens. It's all Bhagwan Bharose now.
So you delivered
in
second
29th
baby
week.
In the 7th month?
Yeah, 29th week,
Okay.
3 days. So my baby was in an ICU for almost 1.5 months.
How big was she when she was
She was 1 kg.
1 kg?
She was 1 kg, and that time was so stressful because I couldn't produce much milk because of that. Stress is the one of the point where which impact the milk production for sure. So for first few days it was little hard. Then we started meeting her and seeing her in that incubator, and we started oral feeding that with vati, chamcha and all those things because she was so small and tiny, so we couldn't give her. I went to Mangala Wani ma'am for that only because I was so stressed out, I'm not getting my milk, and she was like, no, you will get it, don't worry, be positive. And she gave some medications as she said, because they were not having any issues on my body, but yeah, sure, I was having positivity that I can give milk to my baby. She got discharged in June and she was 1600 grams when she got the discharge. We have to wait till 2.5 kg when she born.
Correct.
And after that, 2.5 kg when she reached over there, again the actual breastfeeding journey started, and all roller coaster ride started for me because the first is latching problem. So she couldn't, because she was used to that oral feed.
Correct.
So she was not knowing
the cup
she
and
has
spoon.
to suck that.
And in spite of going through such tremendous trauma, losing a child, the second child being only 1 kilo, in spite of that stress, that's what a mother is, right?
Yeah.
Thank you, Sayali, for sharing that beautiful story of strength and triumph and victory over trauma that you went through.
Yeah.
Sayali, why don't we hear from you about your journey?
So I have 2 kids, and the difference that I have seen in both the journeys is that during my first pregnancy, I was very young and I didn't have any lactation consultant or anyone to give me knowledge about the breastfeeding journey that I'll be having, and there was no one to guide. So even after I gave birth, for nearly 2 days, I was not given my baby for the breastfeeding at all. But then we were adamant at that time, and then that is when they gave the baby. But then it was a lot of struggle because I didn't know even how to hold the baby and how the latching will happen. So the baby was crying, I was frustrated and angry like how it will happen and all. And it was a little bit traumatic experience. But now during this pregnancy, I had her, Mangala Wani, as my gynac, and thankfully she is the lactation expert as well. So she had told me first and only that, after the delivery, I will give the baby in the hospital room, the operation theatre itself for breastfeeding. So I was really very happy, and it was a beautiful experience for me. Like after birth, the baby immediately latched to me, and the bonding is quite different, And I didn't face any difficulty at all because she was there to guide me throughout the journey. And yeah, one difficulty that I faced is like after 2 months, my son had his exams, online schools were there due to COVID and all. So it was a stressful time for me, like ensuring, that he's studying along with taking care of the baby and all. So that all stress, led to the mastitis infection that I had. And yeah, it was
That's very painful. I've heard about it.
Extremely painful.
You were on antibiotics?
Yes, I was. But she was there to, guide me through it. She told me that it's okay, you can breastfeed even during this infection also.
Oh, so even during the infection, you can still... But isn't it
yes.
very painful for the mother?
Not at all.
Actually, it relieves
the pain. It is better. So mastitis or even the breast abscess, even there is a pus inside, still the breastfeeding can be continued. It is very harmless to the baby.
That just shows how important it is to have the right doctors guiding you, the right lactation consultants helping you. Because like we saw from the stories here and from our two doctors, breastfeeding can be a very joyous journey. It can be something wonderful you do for your child. It can be a beautiful memory, or it can be one of the most traumatic experience. And the difference is the right information, the right guide. Stay happy, because that's when you can keep your baby happy. Thank you very much.
तकदीर अपनी उजली ढूंढने है वो निकली तकदीर अपनी उजली इल्ली ने मन में ठाना है बन के